Good evening to all of you. So, welcome to the psychiatry part. Last for the day, but worth it. Okay, good evening, all of you. So, you have been attending these sessions from 5 p.m. now. So, I have seen that. And all right. Okay. So, we are today going to discuss the must know topics for yours psychiatry for NEET-PG. Okay. Unlike the rapid fast sessions you have had, I'll take it a little slower. Okay, so as far as psychiatry is concerned, first of all, I don't have any slides. This is my pen and this is my paper, and here begins the session. Okay, so NEET-PG 2021. So what is the uniqueness of this exam? As you all know, 200 questions. Okay, so when it was a 300 question NEET paper, the last 3 years had psychiatry questions around 8 to 10. So what I am expecting is around 5 to 6 questions. Okay, around 5 to 6 questions. So you can take these 5 to 6 questions in your account if you know how a psychiatry paper is framed. When they frame a psychiatry paper, they might ask a symptom. Okay, they might ask, as you all know, now you have 1 minute per question. So it is probable that rather than asking flight of idea is seen in mania, they might give you a scenario that patient is being interviewed by the clinician, and the patient says, I am mad like the sand, and they will give you a verbatim. So it is possible that you might get clinical verbatims to identify the symptoms. Clinical verbatims to identify the symptom. Okay, clinical verbatim. So what are the major things which they can give you in a clinical verbatim? Okay, perseveration, flight of ideas, loss of association, neologisms, and circumstantiality, tangentiality. I am writing everything, so I suppose that you are writing. Okay, okay. Please listen. So they can ask you a clinical verbatim because symptom based questions always come in psychiatry. Previously they used to ask that perseveration is seen in, flight of ideas seen in, loosening of association seen in, neologism seen in, circumstantiality, tangentiality seen in. Now there are chances of more of clinical verbatims on these particular thing. If the patient is asked a question and he replies same answer to every question asked to him as the first answer given, that is perseveration. Perseveration is persistence of the same response beyond the point of relevance. I asked the patient, what is your name? He replied Ram, and to every other subsequent question he replied Ram. That is perseveration. Please try to revise along with me. Okay, I am not here to revise, you are here to revise, so you should revise. Okay, try to revise along with me. These symptoms, I am not going to tell you 100 things. I will tell you 20 things in 20 minutes and you will remember those 20 things after 20 minutes. I have decided some 20 points to be spoken, and you have to keep those 20 points in mind. You have to write it. No slides, no PPT, nothing. You have to write it. Okay. Perseveration is persistence of the same response beyond the point of relevance. You know this. It is seen in organic mental disorders. Flight of ideas is when the patient's speech shifts from one topic to another, and in between the two speeches there is random one-word connection. I arrived by a flight was of this, then I went there, I met a girl name was Sapna, Sapna is that. So individual sentences are connected to each other, the speed of this speech is increased. It is seen in mania. And when there is absolutely no connection, we call it as loss of association, seen in schizophrenia. Alright, seen in schizophrenia. Same word, new word formation, also schizophrenia. When new words are formed by the patient will speak something, you will get a clinical question in which there will be a word not understandable by the examiner but understandable by the patient. Okay. Circumstantiality and tangentiality. When the patient is asked a question, he gives a detailed explanation but reaches the answer is circumstantiality. He just keep on giving you details, never reaching the answer is tangentiality. These are seen in mood disorders. You can forget anything, but you cannot forget these 5 points of symptomatology. Must know. 5 points I have said to you, only 5. You cannot forget. When will you revise these notes? On the day before the NEET exam. On the day before NEET exam. After today, you will read this on 17th April, 15 minutes for psychiatry. Okay, I only want you to see this for 15 minutes on 17th April, and on 18th April evening you will message me that I saw this and it helped. I'm sure about it. Okay, so you will see this on 17th April for 15 minutes. On the last day, this is what you have to see. Only 15 minutes for my subject, kindly spare. Alright, now first type of question comes in psychiatry on symptom. Second type of question comes on diagnosis and management. Okay, second type of question comes on diagnosis and management, where we speak of clinical psychiatry. Third type of question comes on psychology. The most important topic here is defense mechanism. A clinical question might come on a scenario related to defense mechanism. Defense mechanism. Have you written up to this? Have you written these 5 points? Please see, I mentioned 5 to 6 questions of psychiatry I am expecting. Please see to it, at least 1 to 2 questions in psychiatry are from drugs. Psychopharmacology. Last year they asked lithium in details. They asked SSRI and especially the side effects. They asked antipsychotics, especially the extrapyramidal side effects. I was seeing the sessions before me, and I have seen Dr. Thiru sir's session, and he has spoken to you about extrapyramidal side effect. Yes, and we have done this also in DVT sessions. SSRI side effects. There are clinical questions expected on these drugs. 1 to 2 questions will be related to the drugs. Okay, 1 question may be related to the defense mechanisms, then 1 question related to the symptomatology, and remaining 3 to 4 questions may be around clinical psychiatry. This is just a brief analysis and calculation. I have studied all the previous NEET papers. I've seen the topics. Okay, you have to see all subject papers. I have to see only psychiatry paper. So my analysis would be little better than your analysis. You can trust me on that. I have done homework for that, and I have identified that these are the areas on which questions have been asked and likely to be asked. Okay, please remember, we have to score at least 5 questions in psychiatry. 20 marks we have to take in our account from this particular subject. We have to score. Even if you get 5 on 6, I am okay with that. One question if you miss, fine. Don't miss more than one. Don't miss more than one. If there are total 5 questions, you get 4 on 5, fine. There may be 5 questions, there may be 6. You get 4 on 5 or 5 on 6, fine. Okay, even one question if you miss, fair, but you should not miss more than one. Let us speak about clinical psychiatry. I will tell you 10 important cases only. 10 important cases only. Okay, I will tell you only 10 things, 10 important cases, that's all. You have to keep that in mind. Those are must. No, not desirable to know. That you must know. Okay. First case. Diagnosis of schizophrenia. You will get a patient who has delusions, hallucination, disorganized speech, disorganized behavior. But in exam, when you have to diagnose schizophrenia, there will be an option of delusional disorder. So the most important thing is to differentiate schizophrenia from delusional disorder. You will mark it delusion only. Delusion only. All of you will keep this in mind, that if I get a case of psychosis where there is person hearing voices, feeling people want to kill me, delusion of persecution, auditory hallucination, then you have to see whether the patient has only delusion or delusion plus many things. If only delusion, delusional disorder. If delusion plus many things, then it is schizophrenia. Okay. It has more occupational impairment, job affection. It has less. That's all. Case number 1 finished. Only 2 points. Please remember, MCQ exam, we have to identify the options and differentiate between the two options. Students say, I get confused between these two options. What you say, I get confused, I am only discussing that, not discussing the complete topic at all. Schizophrenia versus delusional disorder, only 1 point to keep in mind. Too much affected, schizophrenia, only delusion, delusional disorder. More job impairment, schizophrenia, less delusional disorder. Case over. Case number 2. Depression with psychotic symptoms. Please remember, in psychiatry, psychotic symptom means delusion, hallucination. In depression, we get delusion of guilt, that I have done bad, sin, I am sinful, and voices that provoke suicide. Okay, so you will get a patient of low mood, anhedonia, suicidal thoughts, Tell me, depression with psychotic symptoms. Is it a severe depression or is it a mild depression? It is a severe depression. Asked in NEET-PG 2020. The problem is the student get confused with the voices. They believe that if voices are there, it has to be schizophrenia. You have to differentiate this case from schizophrenia. Schizophrenia, the voices say, I will kill you. Depression with psychosis, the voices say, go and die yourself. Go and die yourself. This is how you will differentiate depression with psychosis from schizophrenia. And when you treat such cases, you have to give antidepressant plus antipsychotic. Unlike here, where you give only antipsychotic. This is case number 2. This question was marked wrong by many students, that depression can have psychosis when it is severe. The student believed depression is a neurosis. No, depression is a mood disorder which can have psychosis when delusion hallucination present. These delusion hallucination are in according with the depressed mood. Hence we call them as mood congruent delusions. It also includes nihilism. Nihilism. Yes, have you written this? Did you get it? So the second type of case which you can get is depression with psychosis versus schizophrenia. You think you can differentiate the two? Is this differentiable? Third case. Bipolar disorder versus schizoaffective disorder. Have a look here. A bipolar disorder will have manic symptom, depressive symptom, in between period normal. On other hand, a schizoaffective disorder will have manic symptoms, then in between psychotic symptoms, and then depressive symptoms. So this is a bipolar affective disorder. Nihilism is in depression, and this is a schizoaffective disorder. No psychotic symptoms when mood is normal. Psychotic symptoms present in normal mood. This is how you will differentiate bipolar affective disorder from schizoaffective disorder, because even bipolar disorder can have mania plus psychosis, can have depression plus psychosis, but when the mood is normal, they will not have psychosis. Schizoaffective has mania plus psychosis, depression plus psychosis, but in between psychosis present in normal mood. In between psychosis present in normal mood. Okay, this is the third case which you need to keep in mind. Have you followed? If you compare this with schizophrenia also, course wise, schizophrenia is a continuous illness with exacerbation and remissions. It doesn't have predominant mood symptoms. Whenever you will get a question on bipolar affective, the options in the differentials will always be schizoaffective or schizophrenia. The options will always be schizoaffective or schizophrenia. Have you followed up to this? Have you followed up to this? Please don't miss BPAD1, mania depression. Please don't miss BPAD2, hypomania depression. Please don't miss cyclothymia. Please don't miss rapid cyclers. These definitions are important. In a clinical question, mania and depression, bipolar 1, hypomania and depression, bipolar 2, hypomania and subsyndromal depression, cyclothymia, 2 years, rapid cycler, 4 episodes in 1 year. Case number 4, anxiety disorders. When you see a patient with continuous anxiety, mark GAD. When you see a patient with episodic anxiety, mark panic. When you see a patient with episodic anxiety with a stimulus, mark phobia. Whenever you will get a question on this, a clinical question, all these three will be the differentiating choices. This question came in NEET 19. Feeling of impending doom. Something bad, great and disastrous is going to happen. GAD is free floating anxiety. Okay, case number 4 is clear. About every case, I am just letting you know the most important, the key areas, the important areas which you just can't afford to miss. Case number 4 noted. Yes. Case number 5 is body dysmorphic disorder. In this, the person feels my nose is not proper, my part of body is disfigured. Now you have to see that this can be an obsessional thought. If the patient has a firm belief that yes, my nose is ugly and he is inconvincible, please mark the answer as delusional dysmorphophobia. And if the patient has a doubt that yes, my nose is ugly, not ugly, ugly, not ugly, mark the answer as OCD. Shagun Batra. Social phobia and avoidant personality both avoid social situation. If you send them both on the stage, social phobia will have symptom, avoidant personality will not have symptoms. Case number 5. Did you get it? Body dysmorphic disorder. Case number 6. After a major trauma, you might guess a case of patient having hyperarousal, intrusiveness, avoidance. Hyperarousal, intrusiveness, avoidance. We call it as PTSD if the duration is more than 1 month. We call it as acute stress if the duration is less than 1 month. After a routine life stress, if the patient gets mild depression and anxiety symptoms, we call it as adjustment disorder. You might get a case to differentiate adjustment disorder from depression. Adjustment disorder will always have mild depression. If the symptoms are severe, we call it as depression, not adjustment disorder. If after stress, either severe symptoms like psychosis or suicide, then mark answer as depression. PTSD has been asked in NEET 2018. So it is likely to be asked. This was case number 6. I hope you are able to follow. I hope you are writing this. Case number 7. If the patient presents to you with multiple somatic complaints, too much of pain, or if the patient presents to you with only pain long standing, or the patient presents to you with a preset diagnosis in mind. Whenever a question comes on this, the options will be somatization, somatoform pain, and hypochondritis. Somatization, somatoform pain, and hypochondritis. Case number 8. The recent trending topic asked in the exam: depersonalization, derealization. Both of these are dissociative, or you can call them as disorder of perception of self. In depersonalization, the person becomes detached from self, and in derealization, detached from environment. Asked in last year AIMS exam as well. Both of these are called as if phenomenons. As if phenomenons. It is an important case. Detached from self, observing myself from environment, change in me, change in environment. Other name of hypochondritis is illness anxiety disorder. Shubham Singh. Have you followed this case? Case number 9. How to differentiate delirium, dementia, amnestic syndrome. Delirium has altered sensorium. So whenever the patient is having disorientation, dementia has clear. Amnestic syndrome also has clear. Amnestic syndrome has mainly amnesia, and in dementia all cognitive functions affected. Depersonalization means detached from self, Priya, and derealization means detached from environment. You feel that something is changed in you, that is depersonalization. You feel that something is changed in environment, that is derealization. Case number 10, how to differentiate eating disorders, anorexia nervosa, bulimia nervosa, and binge eating disorder. In anorexia nervosa, there is A, B, C. The patient avoids, then binge, then compensate. Bulimia nervosa, there is no avoidance. And binge eating disorder, there is no compensation. Asking for multiple investigation is it all? Yes, we do have time duration for adjustment disorder, Divya. It has to happen within 1 month of stress as per ICD, within 3 months of stress as per DSM. So these are the 10 most important case scenarios I have decided for you to deliver. If you wish, I can tell a couple of more. Like for example, if you get a question on substance use, the most important clinical question you will get either on alcohol withdrawal, tremors, seizures, delirium, etc., or on opioid withdrawal, mydriasis, rhinorrhea, lacrimation. I was seeing Dr. Thirusar's slides and he mentioned you about the drugs benzodiazepine, lofexinidine, and naltrexone, etc., etc. Then in sleep they might ask you about narcolepsy, a tetrad of daytime sleepiness, hypnagogic, hypnopompic hallucinations, then sleep paralysis, cataplexy, or they might ask you night terrors versus nightmares. A girl wakes up in middle of the night with a scream. On waking up, she is confused and disoriented. Night terror. A girl wakes up at 4 a.m. in the morning. On waking up, she says she was having a dreadful dream in which somebody was trying to kidnap her. Nightmare. Okay? 13th and the last case of the day. How to differentiate the closely appearing personality disorders. Schizoid means alone and cold. Schizotypical means magical, odd beliefs, delusions. And paranoid means suspicious. Borderline means unstable emotionally, can't maintain relations. Narcissistic means self-love, loving self. Histrionic means attention seeking. Only one word I am giving you. Antisocial means psychopaths. criminals. Avoidant means introvert. Dependent means can't take decisions. OCPD or anancastic means perfectionist. And this is what you need not be in the last month of your preparation. So my last 2 minutes message to you, please, number one, we don't have to get all correct. We have to get most question correct. If I need to improve, I must correct my mistakes and overcome my shortcomings. And last, your exam is 2 to 5 p.m. I will practice MCQs from 2 to 5 p.m. Okay, may good luck with you. Okay, may you get the best you want, the best you deserve. I'm winding up my session here today because there is no end if I keep on speaking. Please see this video. If you have missed making notes, please see to that you revise these notes on the last day. Okay, I tried to cover as much as I could in this particular time slot I had. Okay, I hope I was helpful. I'll wait for your comments, suggestion and feedbacks. Last couple of things from my side. Please don't become very anxious. The paper pattern has changed. The question number has reduced. That means you have to face less number of enemies. Previously you had 300 enemies to fire. Now you have 200 enemies to fire. 100 enemies are already finished. So previously we used to say 220, 230. Now I am saying 140, 150. And you'll get it. Don't worry. Don't let your anxiety kill your 5 marks. In the last 1 month, the one who has the best mental balance, the best perseverance, the best ability to handle anxiety, stop discussing with your friends, stop making too much of discussions, because it will unnecessarily increase anxiety. Give mock test, stay prepared, don't panic. It's easy to say don't panic, but it's very difficult to do that. Wish you all the best. If you feel any need, please stay in touch. I'm more than reachable. Most of the students have my number also. So I wish you all the best. May the best of luck be with you. Even you carry my luck also with you. That's also with you. I wish all of you farewell. Okay, my special blessings from Gautam Nagar. Okay, thank you so much. Good night. Have a nice day. That's all from my side. My best wishes. Dr. Sachin signing off.